treating the suboccipitals with the client face down is pretty great on you for the therapist body, because you can just use your body weight and sink in. And even though the client is down in the face cradle, we can ask them to activate the muscles and move a little bit, and that really does help to shift that tension. And even though, again, they're in the face cradle, that really can be achieved. And so I'm just kind of taking my hand, my fingers, and rubbing all along that occipital ridge to prepare the suboccipitals for some specific work. So suboccipitals attaching along that occipital ridge into C1 and C2. So remember, C1 doesn't really have any arms out to the sides that we can feel because the occiput rests right on them. And the first cervical vertebra we can really palpate is C2. And so if you come off the occipital ridge and glide down, kind of trace it with the tops of your fingers and come out almost to the ear, almost down from the ear, you'll feel the hard thickness of C2. And you can do that on both sides, feeling, palpating into the kind of firm thickness of C2. Now just behind that, right on C2 right there, is a very tender spot in obliques capitis. So we're going to address rectus capitis, obliques capitis. Oh, we got this back here. All those beautiful suboccipitals. Now here's a really cool thing. Rectus capitis is continuous with the brain through what's called the dura mater, which is the bridge. That it's a connective tissue bridge that connects the suboccipital muscles literally to the wrapper around your brain. And so deeply felt headaches can partly be a result of tension here in these suboccipital muscles. And again, as we've said before, the suboccipitals are really activated in stress because they're helping your body, your eyes look around and follow and looking for danger, following movement and so forth. So ideally, you'd like to have your body set up so that your arm can be straight and your thumb is going to find one side just right off the spine as it rolls off the spinous process of the center of the spine. And I start to go into that first section of the little valley in there. So we're going to press in two different directions. The first one, we're going to press up toward the head. So I want to get back behind my work a little bit and sink my thumb down so that I'm kind of below that occipital ridge, kind of deep in there a little bit. And then I straighten my thumb and angle that pressure up, and I trap that tissue up at the base of the skull. How about that pressure?
It feels good.
Feels good. Would you like a little more? See if.
Sure.
Okay, and then just lean forward. All I have to do is lean forward. How's that feel?
It feels good.
Okay, great. And then just taking a couple of breaths. And remembering that the movement that the suboccipitals create, we have protraction and retraction of the skull, right, on C1. We have a little tilt and tuck. We have a little shaking of the head. We have a little nod. So I'm going to encourage my client to try some of those movements. And what she'll find is that it gets more exciting as she does that. How's that feel? It feels good to press into it, doesn't it? Yeah. Okay, and then you can relax. And then we glide down along it. And then I'm going to glide out again, right off of that spine. And instead of angling up toward the skull, now I'm going to angle straight down to the floor. So I come off the occiput, just lateral to the spine, straighten my arm, and I kind of nestle my thumb in between, right at C2, C1, and pressure is straight down to the floor. And let me know, Jennifer, if that's okay, when you'd like me to stop.
It feels good.
Okay, great. And by good, do you mean that you have no tension there? Or that it feels good to have it pressed on?
It feels good to have it pressed on.
Okay, great. Mm-hmm. So I am literally right off the spine, just off lateral, and then straight down toward the floor. And so then the last place that I'm going to check, and I'm just using this little pillowcase to kind of keep her hair out of the way so you can see a little better. Now the last place that we're going to check in the suboccipitals is that edge of C2. Now this can be a really big headache point. Please be careful and mindful as you're working in this area. So I'm using now my left thumb facing her body straight on. My right hand is just kind of gliding down the back. This spot can be very tender, so I want to be mindful. I kind of wiggle my way in until I reach that bony edge of C2. What else is attaching up in here? We got splenius capitis around here. We got semispinalis along here, right? Erectors as they continue up to the base of the skull. We got middle scalenes attaches up around C2. We've got some maybe top of levator scapula attaching along C2. And then you have suboccipitals, the ones that turn the head and little slight tilt, like maybe, So there's a lot of action here. So we want to go slow. I'm just a little bit heavy in my thumb, and I'm just allowing my thumb to sink. I am not pushing. And what's happening is that her neck muscles continue to soften and allow me to sink in there. I have not changed the amount of pressure that I've used, and I have not pushed at any point. And then now, Jennifer, I'm going to invite you to do a little tilt of the head side to side. Okay, hold on a second. Right ear toward right shoulder, little tiny tilt, and left ear toward left shoulder. Yeah, so just kind of keep going back like you're going maybe. Mm-hmm.
I just did that wrong. What did you
Mm-hmm.
say?
It's okay. Left ear toward the left shoulder, just a tiny little tilt. So no shoulder has to move at all.
Okay.
It's okay. Yep. Just like, yeah, there you go. Feel that contract underneath there. Yep. And then now right ear toward the right shoulder. Stretches. It's going to stretch that a little bit. Yeah, there you go. And then left ear toward left shoulder, just a little bit. Mm-hmm. And then right ear toward right shoulder, just a little bit. Great. And then relax. Yeah, there we go. And then even though it's weird and you're in the face cradle, a little shake of the head, no. Mm-hmm. Great. And then relax and soothe. So that first spot that we get to in those suboccipitals, that first spot is rectus capitis. That's the one that goes right up to your brain through the dura mater, the myodural bridge, and then becomes continuous with that wrapper around the brain, the dura. Okay. So now we're going to do that same treatment on the right side. Okay. Suboccipitals. Notice I just keep doing a lot of soothing. I do a lot of soothing when I'm working neck, really all the time. Okay, so now I come off the occipital ridge, I slide down and I find the spine right there in the middle, like that first section that I can slide into. And then I want to step behind my work a little bit because I want to angle my thumb. I want to scoop it down a little bit and I want to angle it up into the base of the skull. That pressure feel right for you? Feels good, Jennifer? Okay, great. And for these ones, for this side, I'm going to let her choose if she wants to do the movement or if she just wants to breathe and relax. Sometimes when I do the movement with my clients, I'll say, go ahead and just move however you feel like it and let them play a little bit and find just the right angle to press in with. So that thumb is just pressing right up into the base of the skull, into rectus capitis. And in this way, I am literally touching her brain. So cool. Yes, and then I'm going to back off. Let's see. And then now that second point, I go down, slide distally a little bit further away from her head. I hook right next to the spine, right around C2. So I was down and up, angling up toward the head. And now I'm going to point my thumb down and angle toward the floor. I'm going to stand over my arm. My arm is straight. And then I can just get heavy in my knees, bend my knees a little bit, and just lean into that hand a little. It takes a little more pressure than you think that it can handle sometimes. And then, of course, you can let me know at any time, Jennifer, if you want anything to be different. And breathing in your belly. Heavy body on the exhale. Beautiful, beautiful. Beautiful, nice. And then from there, I'm going to slide. I'm going to take a little pressure off because I don't want to dig my whole way. I'm sliding out toward the ear to find that C2. It's right below the occiput, right off the occipital ridge, way out on the side. And I want to kind of rub along that bony prominence of C2. And then I want to get right to the posterior surface of it and press it kind of down toward the floor. Great. And then we release and just glide and do some nice up and down soothing. I might get down on the floor. I like to just change positions, give my body a break in different positions. Oh, so good. And that's treating the suboccipitals prone.